You're very welcome back to Ireland AM. Now, according to latest figures from Breast Cancer Ireland, 1 in every 738 men will be diagnosed with breast cancer at some point in their life.
Joining us now to talk about this ahead of the annual Pink Run are breast cancer survivor Dara McDonough and Breast Cancer Ireland ambassador and GP Dr. Monica Perez-Oikeh. Thank you so much both for being here today. Dara, can we talk to you about finding a lump? Was this in 2021?
2021 during COVID, yeah.
Yeah, what happened?
In the shower and I came across a lump to the right of my right nipple.
Yeah.
Quite significant. It was about 2 centimetres and wasn't sore whatsoever. Hard. So I felt it, then got dried off, went out, and I forgot all about it because it wasn't sore.
Okay.
And the next morning in the shower, I found it again. So I knew it shouldn't be there, and I was very proactive with it. That was on a Saturday and Sunday. On Monday, I phoned my GP. Went into the GP on Tuesday. He felt it, and he said, it's probably just a cyst.
Yeah.
So he told me to come back in on Thursday. He'd a scanner down the back office. Technicians come in on Thursday.
Yeah.
He said, come back in Thursday, we'll scan it, send it down to Dublin, and we'll see what it is. So a few days later, I went in on the Thursday, got the scan. A few days later, the following week, I got a letter from the breast clinic in Eccles Street to ask me to come up, which I duly did. And I was speaking to a professor there, and he said he'd like to further investigate. So I said, okay. So he said he wanted to do a mammogram and a biopsy the following week over in the Mater Hospital.
Yeah. So
I went over and I had the mammogram. Now, breast cancer I didn't think anything about it. I'd a cyst. Yeah. That was it.
Yeah.
I knew a mammogram was an X-ray of the chest, so they were looking at a cyst.
But still, you weren't thinking.
Oh, absolutely. I've never heard of a man having breast cancer.
You'd never heard of a man having breast cancer?
Never heard of it. Breast cancer, no, I had a cyst. That's all it was. I had the biopsy, and the following week I was back in the breast clinic again, and I was told by the professor that I had breast cancer. Now, all I really heard when he said that was cancer.
Yeah.
And so my head went into a spin. And I turned around to him and I said, what are we going to do? And he was coming with me on this journey.
Yeah.
He was going to become my best friend. He had all the answers.
Yeah.
So he told me that it had to come off. Now, I said, what has to come off? He said, I have to take the breast, the nipple, everything has to come off. I did ask him why, and then he said, you have breast cancer.
Oh, he said that you had to have this operation before he told you?
Yes, yeah.
Okay.
Yes, so he told me I had breast cancer, and I did ask him, I said, how have I breast cancer? I'm a man, how have I breast cancer? Now, my head was in a spin in this, but he did I remember him telling me that men also have breast tissue. And he said, it is rare, he said, but men do get breast cancer, and you have breast cancer.
And Monica, this is the case, isn't it? Because, like, we hear about these stories on the show, but I'm sure there's many men watching in this morning who would have no idea that men can get breast cancer.
Absolutely. Whenever I do talks and I mention that everyone, including men, should check their breasts, they make a face. I'm like, yes, we're all born with breast tissue, but with hormonal changes, women tend to develop the breast while men don't necessarily do. So therefore, everyone should do a self-breast exam.
And like with yourself then, Dara, is the treatment similar to what, if anybody who has breast cancer, what was the treatment for you? What did they say?
The treatment, I had mastectomy. They also took out some lymph nodes, and I had chemo injections because within 72 hours of finding the lump, I was with my GP. And because I was very proactive in it, my treatment was mild compared to what it could have been.
So they got it at an early stage?
Absolutely, yeah.
With this, being in a doctor's office and being told that you have cancer, like Monica, you're a doctor, it's shocking. Like, I've gone for a mammogram, and even at that, it's, you know, it's terrifying. You never know what's going to happen. So I'm being told cancer is one thing. I'm assuming, and like, it's just stereotypes and tropes. Being told about breast cancer, did that bring another layer to it for you? Like, was it just even more shocking, I suppose, because you just didn't realise?
I was very, very confused.
Yeah.
I was very scared because of the C word, cancer.
Yeah.
Not so much the breast. And as the treatment progressed and as I was going into waiting rooms, it started to hit me that I had breast cancer.
Yeah.
And that was the confusing part of it. But I knew I had cancer, so I had to have the treatment.
And the treatment then, how long did the treatment last?
Treatment lasted, after the mastectomy, the treatment lasted for about six weeks.
6 weeks.
6 weeks. I'm now 4 years in remission.
Thank God.
And every March I go back for a test and whatever, and everything's good.
Everything's clear.
Good, yeah.
And Dara, you've obviously decided, you know, the very Pink Run is on. This is all about raising much needed funds for breast cancer awareness, for treatment, for all of the other supports that go with it. And Monica, you have been doing this for so long, and it's fantastic. But kind of being like Harriet, I was a man, I'm one of the 738 men that get diagnosed with breast cancer. I'm sure that there's some people going, what? Like, how do you feel about putting it out there and kind of letting people know that this can happen to anyone?
Well, I had a conversation with the professor who diagnosed me and was treating me. We got on very, very well because he doesn't see that many men.
Yeah.
So we got on very, very well. And I remember him telling me that more men diagnosed with breast cancer die than women diagnosed with the same disease. Now, I was very confused when he said this to me because very few men get breast cancer. Then he explained it's men who are diagnosed because we present at a much later stage.
Because they ignore the signs.
We ignore the signs. We don't really know what it is.
So can I ask you, when you felt that lump, was that even a smaller lump and you just noticed it getting bigger, or was it just suddenly you felt that it was there?
It was just suddenly I felt it was there. And as I said, it was 2 centimetres. Now, it wasn't protruding. It was in deep to the right of my right nipple, but 2 centimetre lump is a significant lump.
Yeah.
And
we're going to do a breast exam in a second, Monica, but I suppose, like, obviously, you know, feeling for lumps, but signs and symptoms of cancer, like, it's so important just not to ignore anything that you think is wrong, right?
Yeah, exactly. So, and if we know about breast cancer Ireland actually have a really good podcast called More Than a Lump, and it's to highlight that breast cancer, the symptoms is not just a lump, there are different signs and symptoms that you could have on your breast. It could be a rash, it could be the size, changing the size of the breast, changing the nipple shape, a discharge as well. That is why it's so important to know your body, know your breast, and be comfortable examining yourself, because when you know it and you do it monthly, you'll be able to pick up any changes suddenly.
And it's like for men, I suppose, with testicular cancer, we'd sort of be more aware of maybe feeling for a lump there and if there's anything there. But I suppose it's just so easy. You are sharing, you are in the bath or wherever, and if you're just feeling around and you know yourself there's something that's suddenly there. But it's like that, the old story with men, actually, that'll be grand. But you're saying, like, if you actually feel something is wrong, go and get it seen to.
We can just, the very Pink Run, it's taking place in Dublin on the 6th of September, Cork on the 7th and Kilkenny on the 14th of September. You can support Breast Cancer Ireland by registering verypinkrun.ie. Myself and Monica are going to go over here, because I think
Dara,
it's time that we do a little bit of a breast exam.
This morning
Thank you
and letting us know about that.
So we have here, these are our boobs for the day, Monica. This is what we're doing. But it is so important. And this is for, regardless of your gender,
Yes.
this is what you have to be doing.
Yes.
So where you advise to do it, in the shower, out of the shower?
I always say be intentional about it, because whenever I do ask patients, they say, oh, shall I check it in the shower? But are you intentional about it? So if you want to do it in the shower, that's great. But if you also do it lying flat as well, that's even better as well, because sometimes things you can feel while you're standing, you might feel even better when you're lying flat.
When you're lying down.
Exactly.
Okay.
So that's why you need to be intentional about it and go, today is the day I do my breast exam, and you do both.
Okay, so how do we start it?
So you always start by looking at your breast. So you do it, obviously, if you're wearing a bra off, you do it in front of a mirror, and you're looking at the breast, you're looking at the shape, and you're looking at the size, you're looking to see if there's any changes in the skin. If you think about what a lemon looks like, your breast shouldn't necessarily look like the skin of a lemon.
Okay.
You know? So look for that, if there are any rashes as well.
Okay, so just that little sort of bobbling, that sort of little things, if
yeah.
that's different, if it's not as smooth as it normally would be.
Exactly.
Okay.
Yeah. So once you've looked, you can put your hands up in the air and then turn around to see if there's anything that pops out as well.
Okay.
And then after that, you move on to feeling. So when you feel, you put one hand behind your head, and then with 3 fingers, the pad of your fingers, you start from beneath the collarbone and literally just do that in circular motion. Try to just leave the fingers on the breast there, and you're just feeling. You can start from the top all the way down and go all the way down. You come back up again and you do that, and just keep on feeling one breast at a time. And then when you get to the nipple, make sure you squeeze the nipple to see if there are any discharges. You also go to your armpit as well and feel the...
Under here.
Exactly.
So you have to kind of go under there. And again, the pressure isn't like digging in, it's just softly, is it?
Exactly. You're literally just going in a circular motion and just trying to feel.
And it's important not to forget the top here, because a lot of people just kind of think it's just under here.
Yeah, so you go from the collarbone all the way down underneath the breast into the armpit.
Are people, do you think people are doing it like that? Obviously, I don't think men kind of know that they have to do it as well. But I suppose people do forget or don't think that, you know, I'm in my 20s, it doesn't matter.
I tell you something, in the last 2 weeks, I've met 2 women that had never done a breast exam. And literally, I was in shock. I was like, so people are not doing it. That's why we need to keep on talking about this.
Yeah.
So remind you, anyone from the age of 20, because remember, breast cancer is not just a disease of the older women or men. It can happen in your 20s, 30s, 40s, all the way to...
How often?
Once a month.
Once a month?
Once a month. Just once a month. Pick a day and do your self-exams.
And if you're someone who has a period, does it matter if you should do it when you have your period, after your period?
Towards the end of your period.
Gotcha.
That way, yeah.
That's when you should do it.
Yes.
Monica, thank you so much, as always, because I know that you really do push this all the time and you're always advocating for people to make sure that they check their breasts. So thank you so much, Dr. Monica Perez Oikeh. And you can go to verypinkrun.ie to sign up for that run. Now,